This is the model of heart tube. Our heart is developed from the fusion of two endocardial tube in the cardiogenic area in 3 to 4 week of intrauterine life in the cardiogenic area in the intraembryonic mesoderm. The two endocardial tube get fused to form a single heart tube, and this is the single heart tube which has got an arterial end and venous end. From arterial end to the venous end there is sacculation, then constriction, sacculation, then constriction, sacculation, constriction, then sacculation. Whole of this heart tube get fused, but is caudal end, it is not fused. It gives rise to right horn and the left horn, which further divided into curve, that is the cardinal, umbilical and the vitelline vein. First sacculation is known as bulbous cordis. It is again divided into three parts. The proximal 1/3, it has not given us any special name. The middle 1/3 of the bulbous cordis is named as conus. And the distal 1/3 of the bulbous cordis is truncus arteriosus. This truncus arteriosus will turn into the ascending aorta and the pulmonary trunk. In between these two, at this line, the bulbar septum gets developed. This is the bulbar septum, this one. And this will divide into the ascending aorta and the pulmonary trunk. Ascending aorta and the pulmonary trunk. Okay. We know that through the right ventricle, this pulmonary trunk is coming out, and through the left ventricle, this ascending aorta is going to form an arch and going posteriorly. So, and in the middle, this is conus, the middle 1/3 of the bulbous cordis. It will turn into the outflow tract. Outflow tract of this ascending aorta and the pulmonary trunk, which is named as the upper smooth part of the right ventricle and upper smooth part of the left ventricle. I have given the similar color for the clarification. This conus, outflow tract. Outflow tract is formed by the upper smooth part of the right ventricle and the left ventricle. Now, the proximal 1/3, this black color, it will result into the right ventricle. This one, the trabeculated part. Trabeculated part of the right ventricle. In the atrium, trabeculated and smooth. Trabeculated is anteriorly, smooth part posteriorly. But in case of ventricle, a smooth part is above and trabeculated part is below. The division is like this. Trabeculated means primitive. Okay. So this is primitive. I mean to say trabeculated is there is trabecula, there is rough surface, and rough surface is below and smooth is above. But in case of atrium, roughness lies in the anterior layer and the posterior part is smooth. Okay. So the proximal 1/3 of the bulbous cordis will develop into the trabeculated part of the right ventricle. Now the second sacculation is the primitive ventricle. Whole of this will develop into the trabeculated part of the left ventricle. Again, this is above and below. This is outflow tract. That is the upper smooth part of the left ventricle, and this is the primitive ventricle will develop into the trabeculated part of the left ventricle, in which there is roughness. Trabeculations are there. Okay. So this is worth mentioning that whole of this sacculation will develop into the left ventricle. But one proximal 1/3 part of the bulbous cordis will develop into the trabeculated part of the right ventricle. Okay. And this is bulboventricular sulcus. This will, which will develop into in between black and white. This is black and white in between this interventricular septum. Bulboventricular sulcus will develop into interventricular septum in between the two ventricles. Now, this one is the atrioventricular foramen. Here is one slit like horizontally running foramen. Atrioventricular, here is the atrium and here is the ventricle, atrioventricular foramen, which will develop into the this one septum intermedium, which will take part in later on we will come to know that it will take part in this septum intermedial will take part in many also take part in the interventricular septum and also interatrial septum as well here. Okay. So after that, the third sacculation, this will develop into the right atrium and the left atrium trabeculated part. This is the primitive atrium. This is primitive ventricle and this is primitive atrium. This will result into the trabeculated part of right atrium and the left atrium. This is the trabeculated. This what I am showing the anterior aspect. This is anterior aspect and that is posterior aspect. Posterior is smooth, anterior part is trabeculated. Trabeculated part of the right atrium and the left atrium will develop from the primitive atrium. And there is obliquely placed interatrial septum. Okay. Now, after the primitive atrium, this is the venous in sinus venosus, which divided into a body and then two horn, right horn and left horn. Body as well as the right horn will form the smooth part or posterior smooth part of the right atrium. This in between the sinus venosus and the primitive atrium, this will develop. This is the venous valve. Okay, atriovenous valve. Sinuatrial valve. Sinus venosus atrial. Sinuatrial valve, which will give rise to right and left sinus valve. This is sinuatrial valve. Okay. So body and the right horn forms the posterior smooth part of the right atrium. And what about the posterior smooth part of the left atrium? It is formed by the absorption of the forepulmonary vein. Okay. and this right horn is formed by the incoming of three branches, that is the from lateral to medial it is common cardinal vein, umbilical vein and the vitelline vein, curve. Okay, this will develop into the some part of the superior vena cava. This will regress and the right vitelline, this will form the some part of the inferior vena cava. This will superior and this will inferior. So superior and inferior vena cava will open into the right atrium. Okay, this is the reason. And whole of the left horn will vanish, will reabsorb, except some of the part which form the coronary sinus and oblique vein of the left atrium. Okay, so this is our heart tube. And what changes occur after in adult, this we are seeing. And I would like to explain the transformation of this heart tube into this, but this is not a typical adult heart. Our heart has got no like this arrangement. Okay, it is like this. Suppose this is the heart tube. Okay, this is the first constriction, this is the second constriction, this is the third constriction, and here is the sinus venosus, which is divided into right horn and left horn. Okay, so this is first constriction, this is second, this is third. Okay, and there are four circulation, 1, 2, 3 and 4, and this is arterial in, this is venous in. Now again, three part of the bulbous cord is, this is proximal 1/3, which will develop into the proximal 1/3 will develop into the right head. This is the proximal 1/3. This is the trabeculated part of the right ventricle. Okay, trabeculated part of the right ventricle, and this will develop into the outflow tract, and this will ascending aorta and pulmonary trunk. So this is like this, ascending aorta, and this is pulmonary trunk, ascending aorta, they are forming aortic arches. This is outflow tract, which is nothing but the upper smooth part of the, this is the upper smooth part of the left ventricle, and this is upper smooth part of the right ventricle. Okay, like this. And this is the trabeculated part of the right ventricle, and this is first constriction. This is first constriction. From here the looping occur. The first looping occur at this level only. So this will become the right ventricle, and this is left ventricle. This is left ventricle. Like this, right ventricle and the left ventricle. This is right ventricle, left ventricle. This is interventricular septum. This is interventricular septum. Okay. Now let's sing sinus venosus. Okay, they are going back and they are coming above. Okay, like this, and this is somewhat twisted like this, as right horn toward this side and left horn toward this side. Right horn get reabsorbed. Right, this is right horn and the body get reabsorbed in the forming the posterior smooth part. posterior smooth part of the right atrium, like this. Okay, posterior smooth part of the right atrium. And this is the left horn, which will form the coronary sinus. Coronary sinus lies here. Coronary sinus and an oblique vein of the left atrium. This is left atrium, oblique vein of the left atrium. Okay. So cardiac looping occurs like this. Thank you.